So without further ado, I'll go ahead and introduce to you Director Hanson. Thank him for coming this great distance from Tallahassee. Sir.
Good morning, everybody. We are in the process of, we call it rolling out the iBudget. It's one of the areas we're going to next. So let's talk a little bit about the iBudget and what it's about and why we're doing it and why I think it's a good thing. And I can tell you that we are not going to go forward with anything that we don't think makes things better, that we don't think that is going to improve services to the people that we serve. If it didn't improve it, I don't want to do it. So that's what I really believe that this does make things better. And I can tell you, when I arrived at this job, when Governor Scott appointed me last August, we were about to implement the iBudget. And I said, whoa, let me understand what this is first. Let me understand how this is going to work. Let me see what the implications of this are. And so we sort of slowed things down a bit, and we started studying it. So let me tell you what I think, how I see the iBudget. Let me tell you how I see it works and how I'd like to see it implemented. The iBudget is the next generation after the tiers. And I assume everyone here knows about tiers, right? Does everybody know what tiers are? Everybody? Nobody knows what tiers are? No. Okay. Well, tiers, I'll just start very briefly with tiers. But tiers were a way, and actually the legislature created tiers about 4 or 5 years ago, I don't know exactly how many years ago, as a way to try to say, let's provide some equity in the amount of funding that we provide for someone based on their needs. Try to figure out how do we categorize people's needs based on the services that they require, and we're going to put people into 4 categories. And each category, there's a tier 4, which is the category with the lowest cap. I think the cap was about $14,000 in tier 4. So if your services, usually for people in a family home, there were limited services, but an easiest tier to get into. And then it went up tier 3, tier 2, and then tier 1. And tier 1 had an unlimited cap. Is she okay?
Yeah, just getting or something.
Okay. And tier 1 had an unlimited cap, and it was the hardest group to get into. I think the cap on tier 3 is something like 55,000, and then tier 2 was about 30. I think it's down to 32,000. All those caps got reduced somewhat when the legislature 2 years ago did the 4% across the board rate reduction. That reduced those too. But anyway, people were assigned tiers based on their degree of disability, essentially, and their living setting. And people were given a number. They were saying, you're going to go into this tier. And there was an opportunity. One thing about the Medicaid waiver that's a federal requirement is that if the state wants to reduce the amount of your cost plan, you have a right to appeal that. If you don't agree with that reduction in the cost plan, you can have what's called a fair hearing, where there's an administrative hearing process where you can essentially state your case, and a hearing officer will make a recommendation to me, essentially, to the agency head as to whether or not they made their case, whether or not this is a change. And then the agency head, in this case me, makes that final decision. I look at these all the time. I get these all the time. And I read the hearing officer's report. I look at what the family presented. I look at what the agency presented. I make a decision. Yes, we're going to do what the agency wanted, or no, we're not going to do. We're going to do what the client wants. And then if you disagree with that, if the client disagrees with that, they can take me to court. They can take our agency to court, First District Court of Appeal. So and then it goes through the court system. That's not the way I like doing business. I don't like people suing one another. That to me is not a good way to do business. And the tiers were kind of set up for lawsuits because our agency had something like 6,000 different challenges. In other words, people went to administrative hearings in 6,000 cases. And I did not, of course I wasn't there then. I'm just seeing the end of that right now, those 6,000 appeals, because these things sometimes they take months, sometimes they take years to work through the process. And I'm seeing these and I'm getting these final orders. And I'm like, you know, one of my first things was, I don't want to go through this again. I don't think it's good to where, you know, 6,000 people decide they don't like your action they're going to see. So in implementing the iBudget, one of my goals was, I don't want people to feel like they have to go to court or, you know, request an administrative hearing. I think we had to work together. We had to figure out together what's the right way to go. So the iBudget is really the next step to tiers. And what the iBudget is, it's like everybody gets their own tier. There's no longer a cap. Everyone is evaluated based on their own experience. What we do is, does everyone know what the QSI is? Questionnaire for QSI, questionnaire for situational, what's the last word there? Information. Okay. I actually had a QSI done on me, so I understood all the pieces. I had the folks come in and they said, we don't want to tell you the score. No. I think I passed, but I don't know. But anyway, so I want to understand. So I said, let me see how this QSI. So we do a QSI on everyone, and everyone's got a QSI score. Those scores aren't always correct, and they need to be updated. There are always problems with this kind of thing. We look at where you live. We look at what your age is, because if you're under 21, Medicaid covers more of your services than if you're over 21. And we look at where you live because it costs different amounts depending on whether you live in a family home or independent or supported living or in a group home or in an institution. Those things all make it cost more or less. So we look at all those things, and then we look at a certain couple of questions that determine sort of high-risk factors. A question about, does this person know enough that if the house is on fire that they need to leave the house? Okay. Are they able to move themselves? In other words, are they mobile? Can they transfer themselves? Those kinds of questions. And based on those questions, we run something called an algorithm. And an algorithm's all the rage. An algorithm essentially says, look at all the people that we've served in this program in the past, look at these factors, and try to calculate a number that essentially would be the average amount this person would receive based on this information that you've provided. That's what the algorithm does. It's kind of like an average of what someone in this situation would get. And so we run that for every single person. So we would calculate an algorithm on everyone. Okay? And based on, and what we do then, the second part of the algorithm is, we've got to figure out how much money we have to spend. Because one of the big issues that I've been asked to address is the fact that this agency, APD, has a long history of spending more money than is appropriated to them. And I know people have different views about whether that's good or bad, but there's only so much money to go around. And the legislature and the governor decide how to apportion that money. And what is APD competing with? Okay, APD is competing with Medicaid funding. It's competing with funding for mental health services. It's competing with funding for child welfare services. It's competing for money for universities, for K-12, for the roads out here. So everything has to be apportioned. And just think about if every agency said, oh gee, I know you gave me, you know, $1 billion, but I'm going to spend $1 billion too. Think what that would do if the highway department said, well, I know how much you gave me, but I need a road, I'm going to build one. So I'm going to stick you with the bill. I mean, you'd have chaos. We're the only agency who has done that. And I know the reasons why, and there's good reasons why we've done it. But one of the things they've asked me to do is try to balance the budget, to say, okay, here's how much money you have, try to stay within that budget. And that's one of the key things. So you have the iBudget, and then so what we did with the iBudget is we said, okay, here's how much money they gave us. They gave us, in the current year, $810 million. So I know what everyone's algorithm would be, and so I just adjust that proportionately, so I'm distributing that $810 million. That's essentially what the algorithm does. It fairly proportions that $810 million across all the people that are on the wait list. This does nothing for anybody on the wait list. It just tries to fairly say, here's your fair share of this $810 million. That's what it does. And so that's where I started. And I looked at that number, that would be calculated for each person, and I looked at a bunch of cases, and I said, I want to see how this works. How does this actually work? Does this make sense to me? Because it's like, I liken it to like having a computer design an airplane, and then you build the airplane. I don't know about you, but I don't want to get on that airplane until it takes off once and lands once and takes off again and lands again and takes off again and lands again. I'm not getting on there if a computer says it'll fly. I want to see the thing fly myself, and I want a pilot to say, yeah, this thing flies. And that's the same feeling I had with the iBudget. I want to see this thing work before we actually subject people to it. And what I did is I looked at a bunch of cases and I said, gee, in some cases, the family may have only asked for $20,000 because they're keeping the person in their home and they're providing a lot of the services themselves. And this system's going to give them, the algorithm's going to give them $30,000. Well, that makes no sense to give a family another $10,000 when I have 21,000 people on a waiting list, and the family doesn't need it. So I said, well, first thing I'm going to do is, if the algorithm is more than their cost plan, I'm going to give them their cost plan. I'm not going to give them more than they've asked for, okay? Because if I had enough money, I could do that, but I don't have. I'm short, so it wouldn't make a lot of sense. So the second thing I said is, okay, let's see. I found in a lot of cases that the algorithm didn't give them enough money to live where they're currently living. A lot of times, especially people in group homes, and oftentimes even in family homes, the algorithm wouldn't cover their basic cost of care. And so what are we supposed to do? To say to someone, oh, you're used to getting $40,000 a year, and your group home costs $40,000 a year, but I'm only going to give you $30,000 a year. What are they going to do? So that's not going to work. That's just not going to work. I mean, we can't not give people enough money for a safe place to live. So we said, okay, how do we fix that problem? And we went in and we tried to say, okay, let's look at their cost plan. Let's try to figure out which of the services in their cost plan are really essential services, services that people have got to have to live safely. And of course, that is a very difficult question, is to figure out what are those services. It depends on every person individually. Well, we came to a list of services, and of course this got debated extensively in front of the legislature as to what should be on that list. Some of the things like adult day training and transportation were, and companion and respite, those things are pretty heavily debated as should they be on the list or not. And it depends. I mean, what I came to find out is it depends on each case. Each case is unique. So what we ended up doing is saying, we're going to create a target, we're going to run this algorithm, we're going to compare it to their current cost plan, we're going to give everybody a target. And that's what we've been doing. We've given the support coordinators here a target for every person in this area. Here's what we think the number ought to be. Okay, you tell us, can you live with this number? Is this number fair for you? If you tell us no, it's not, we want to sit down and discuss that. If you tell us it is, then we're fine. And this is what we did in Area 1. And we had in the Panhandle, when we implemented the algorithm in the Panhandle. And what we found was we had 3,000 people on the waiver that we implemented the iBudget, and we got 100 administrative hearing requests. Only 100 out of 3,000 people, which compared to the tiers, that was a much better result. I was hoping that we'd have fewer, and we had a lot fewer. Okay, and so that's what we're trying to do here. The same thing, we're trying to roll this out in a gradual way across the state, learn as we go, give everybody a number. Here's what we think your fair share of this appropriation is. But if you don't think it's a good number, let's discuss it. Let's see what number you really think you need, and let's figure out what is it that we need to do to make sure that you have an appropriate allocation from the state. And we want to also make sure that people are not looking to the state as the first source of revenue. There are a lot of other things a lot of other resources that can be found, and we know that we're never going to be able to get to the waiting list until we have confidence in the people that appropriate this money, that we're using it as wisely and as efficiently as we can. I mean, I work for the legislature. I know the people who make these decisions. Senator Alexander was the Senate Appropriations Chair last year. I actually worked with him prior to working for this, to coming to work for this agency, and he sat me down and said, let me tell you what I think about this. He said, you know, I believe the people that APD serves are the most vulnerable of the most vulnerable. If anybody deserves state support, the folks served by APD deserve state support. And that thought is echoed, I think, by every one of the policymakers. This population truly deserves state services. There's no doubt about that in anybody's mind. Yes, ma'am.
Can we stop you and ask you a question, or do we wait until you're finished talking, then we ask you the questions?
Okay, I would rather, if I could, just get through. I would just have one more thing I'm going to do, and then I'll start taking questions.
Okay, thank you.
But so his point was that, yes, this population needs to be served. But he had to balance the state budget. And you can imagine the pressures that someone like that is under from the school system, from the transportation system, you know, from the criminal justice system, from environmental programs. He's got to balance all of that. And he said, I think this is an important population to serve, but you got to convince me that you're spending this money wisely and appropriately. And so that's when I said, you know what? You know, you're absolutely right. We do need to do that. And that's when we said, we're going to look at every single cost plan. And that's when we went through the process of going through every single cost plan and say, are we doing this wisely and fairly? Have we maximized other resources? You know, there are a lot of community resources. Have we maximized those? Have we been as efficient with this money as we can? And so that's what we started with that cost plan review. And that's what we're trying to do here again with the iBudget. And in fact, I think because they had some level of confidence, both the governor and the legislature, in what we were doing, they increased our appropriation going forward. They increased it from $810 million in the current year. For next year, we have $877 million. So we have about a $67 million appropriation increase, which I find very exciting. It's a great opportunity. What I would love to be able to do is I would love to be able to balance my budget. Even at $877 million, I was spending, in the current year when I got to this agency, we were spending about $930 million a year. So we were $120 million over the appropriation. So I'm still way over the $877 million. But I think that we're making progress we've tested a number of different things to try to reduce our spending and be more efficient with our spending, that hopefully our spending will be such in the next year, in the 12-13 fiscal year, which starts July 1, so that not only will we live within that $877 million appropriation, but we'll have some money left over and we can start bringing people off the wait list. And that's what everyone wants us to do. So that's our goal. We want to fairly apportion the money, and at the same time, we want to make sure that the money we have, we can begin serving people who are on the wait list. That's what we'd like to be able to accomplish. So that's why I'm asking everyone to consider what you need and only what you need as your fair share of this, and be willing to share with others. You know, the $877 million was an increase, so the legislature did give us more money. I don't know what they will give us more money or not in the future. I don't know. But it's really important that we work together and everyone try to come, you know, to sit down around the table and figure out what is the best way to do this. There's just one other thing I wanted to mention that I found that that's very important to me. And as I said, I review every new admission to the waiver. And we have what we call a freeze on new admissions, except for a crisis. And a crisis is defined as someone who's at risk, a danger to themselves or others, or someone who would become homeless if they don't get services. And then we also allow cost plan increases. If someone is on the waiver and something happens, a caregiver, for example, becomes ill and is unable to continue to provide care, a client may need additional money in their cost plan. They may need to go from living in the family home to living in a group home. Or they may need additional services in the family home. Or they may be in a group home and they may need a higher level of care in the group home. So I look at all those cases as well. And one thing that distresses me when I do that is the fact that we have a lot of kids that are coming into care in APD that for various reasons they're not able to stay in the family home. This is often associated with violent behavior of these kids, that they are really a danger to themselves, or they're a danger to their parents or their siblings, which to me is, just think of the stress on the family when that happens. What a huge dilemma that is for people. And one of the solutions that they ask us to pursue as the outcome is to place the child in a group home. Now, group homes are great places for people that need to live in a group home. But I have requests for a 6-year-old to be put in a group home. And I think about that and I think, what's going to happen to that child? Now, I can tell you that the child has behaviors that are very, very, very difficult to deal with. I understand that. But when I know that when I sign off on that sheet and that child is placed in a group home, that's probably where they're going to be for the rest of their lives. That is not a good outcome for me. I don't think that's acceptable. And we sat down, Secretary Wilkins of the Department of Children and Families, as I discussed this with him, we had a group of folks sit around the table yesterday, the child welfare folks, and I said, tell me how this, how this happens. I mean, how can you take a 6-year-old, and in most cases they're not that young, they're 10 or 15, 12 or 15, and put them in a group home and write them off, and that's the end of the story for them. They're going to be there the rest of their lives. I'm just not satisfied. I'm not comfortable with that outcome. I'm just not. We need to try to figure out a way to provide the services that this client needs, figure out what's going on in that family, and say, okay, after a certain period of time, we're going to provide these services and we're going to try to reunite this family. Or we're going to bring this child to a relative, some other family, but we're not going to stick them in a group home for the rest of their lives. In the child welfare system, when you take a child from a family for various reasons, they have a 9-month requirement that at the end of 9 months, that child has to be in a family situation. They have to be placed in some sort of normal setting. Okay, they can't be left in an institution or a group home. They've got to be either with a family, if not with their family, with an adoptive parent, some kind of outcome. So one thing that I'm trying to do is figure out a similar system for the kids that we serve, so that no child ends up with a label on them, on their forehead, this person's developmentally disabled, and they're going to a group home for the rest of their lives. That should be the absolute last thing that we do for the children that we serve. And I know that that also happens to adults, that adults get labeled and stuck in a group home and they stay there forever. And I'm just hoping the children are first. We've got to deal with the children first, because that's the gravest concern, I think, in that regard. But then we need to move on to other folks to see if there are other outcomes. And that's one of the reasons, how many have heard about the scorecards that we're doing? Have you heard about the scorecards? What we're doing is we're trying to score all of the providers. We started with support coordinators, and you may like it or you may not like the scores, but it's similar to the education system. When schools got graded, no one liked the grading system at first. My daughter was in elementary school when we started grading schools, and I know the schools didn't like the grading system, but I sure liked it. I mean, I liked the fact that I knew my daughter was going to I was in Wakulla County, she went to an A school. Her high school was a D high school. I wasn't too happy about that. They are now, by the time she got there, it was an A high school, because the pressure from the community was, this is important. I mean, why are we a D school? Why are so many of our students failing? Why are so many of our students dropping out or not passing? And so why can't they pass the FCAT? And so that turned things around. And we're trying to do something similar with scorecards. We started with support coordinators because they're so important. And of course, the first thing everybody says is, well, the data's bad. You can't score me because you don't have good data. And my response to that is, fine. If the data's bad, get me the right data, because we're going to score you. And we're doing the same thing with group homes and with adult day training providers and supported employment providers. Again, with the goal of saying, let's look at who's successful. The way we're evaluating group homes is, are people's problematic behaviors being improved? Can we step them down after a period of time? If we put them in at a very intense level, are we getting results from that? And at the end of the day, you know, are their lives getting better? Do they need less intense services as time goes on? Are these services that they're providing effective? And so that's what we're trying to evaluate, and it goes back to just what I said with the foster kids. We're going to evaluate how long kids are in group homes. And we're running the data right now to see that. I'm very interested to see what length of time, because the federal government says they shouldn't be there any longer than 9 months. I have a feeling that, well, in foster care, you shouldn't be in foster care. By the time when you come into the foster care system, you're supposed to have permanency within 9 months. That's the goal. And I think they're trying to approach that goal. And I'd like to see a similar goal for the children in our system, that from the time they leave their home, they have some permanency within a year. And so we're going to look at all those things. We're going to use scorecards to look at those things. And hopefully, within some short period of time, not too long a period of time, we're going to be able to move to a situation where you as parents or caregivers can evaluate all the options you have for selecting providers, and you're going to be able to choose a provider based on the quality of care that that provider offers. That's what we're shooting for, and that's what we're trying to get to with scorecards. So with that, I'm going to stop, and I believe Sadie had a question. Sadie, sorry.
Yeah, I just wanted to know, who determines the algorithm?
How about if we use the microphone and everyone can hear your question? That'd be great.
Thank you. I just wanted to know who determines the algorithms? What group of people or whatever?
Thank you, man. Appreciate that. There are a lot of confusing terms here, and I understand that. Basically, what sort of the first step, the thing that we call the algorithm, which is just I think of the algorithm as like a ruler or a measuring device. It gives you an idea of where to start. That's all it is. It's something to try to say, here's a starting point. What it is, it's simply a mathematical calculation. We hired a professor, actually the head of the Department of Statistics at Florida State University. Actually, we gave him all the data. And the data came from the ADC system. We gave him all that data, and he calculated, based on all that data, what that number is. So it's just a mathematical calculation is all it is. Now that's not what we use to come up with your proposed number. That is a starting point. We primarily look at your current cost plan and say what's in your cost plan and which of those services, how does that cost plan compare for you compared to other similarly situated people? That's what we use as a sort of a measuring stick. We look at the algorithm, we look at the cost plan, we look at the unique circumstances, we talk to the family, we talk to the support coordinator, and then we say, okay, this number seems to make sense to us. Other questions? Art's going to pass out the microphone.
Okay, questions? Start there and we'll come back.
Hi, Mr. Hanson. Thank you so much for coming. Hello? Can you hear me?
Yeah, we got you.
Hi, I'm glad you came. I can't imagine being in your position. I wouldn't want that job for any amount of money. From what I've researched on you, you are the guy to do it, though. So I have high hopes. I'm Ken LaRoe. I'm the CEO of First Green Bank. It's the second bank I've started in the state. Collectively, I've employed a couple hundred people. I've got plenty of ideas about what can be done at the state level. My son is handicapped with a chromosomal abnormality. Those 18 years on the wait list before he started getting services were extremely painful. He had severe behavioral issues, and I don't know some of the other parents in the room, but I've been at the point where I've literally thought, I can't do it anymore. And if I couldn't do it anymore and something terrible happened, or I was to move out of the state to a state that had better services, the state of Florida would have lost an entrepreneur and someone who has created a lot of jobs. I think your measure should not be how much money you spend, but where you rank nationally for services for the disabled, and Florida has historically always been 49th, 48th. You are not going to recruit people like me. You're not going to recruit a brain trust to the state if someone has a handicapped person. I understand you've got a pretty direct line of communication with the governor. I would certainly hope you convey that to him. With the cuts that have already taken place, my son's care has diminished dramatically. The people that are good don't stay. I know I would not want to be bathing an adult man and wiping his butt for $7.40 an hour. It just ain't happening. I'd be more than glad to converse later and give some of my ideas, because I don't think this is the forum where we have the time. But if I could leave you my business card,
Yes, sir.
I'd be glad to.
I appreciate that. I appreciate your comments, and unfortunately, your situation is shared by many, many families in Florida. And it's unfortunate that it does become a decision. You know, how can I go on? Again, I deal with those. It's nothing like what families have to deal with. I get that, and I feel terrible. I wish there was some way to fix this. I wish there was. I really, really do. But you're a businessman. You run a bank. Notwithstanding what we just heard about the National Bank yesterday, most banks can't, lend more money than they have, or they have to have greater returns than what they have, money coming back than what they're losing. And we're in the same situation. Florida is one of the lowest, per capita spending states for health and human services. There's no doubt about that. Why is that? The reason is very tied up with our tax structure. This is a low-tax state. The idea is low tax attracts business, and the more business, and this is something the governor, as you hear him, we're competing with other states. He thinks we're in the top. I think we're in the top. And I think Texas is our biggest competitor. Increased taxing is not the way to attract business to Florida. It's not the way. I noticed here all the development going on, and it's wonderful to see that this, the economy's thriving here in Wildwood. And I think that's the sort of dynamic that you're dealing with here. There are a lot of states that spend a lot more. New York, for example. But I came here from the Northeast. I thought their tax structure was incredible. I mean, they tax everything that moves up there, and I think it really does stifle entrepreneurs like yourself. So there is somewhat of a trade-off here between the tax structure and the amount of services that we can provide. And in your case, if you had decided, or if you decide that you can no longer deal with this situation, there is a way to bring this through crisis. And we serve families like yours every day through that process. So I just want you to know that that process is available. If you feel like you need to pursue it, we will work with you.
Hello.
Hi.
It's her question and mine both.
Okay.
She's been living in stress for a few days.
What are your names, please?
My name is Mrs. Amin. We know the name, her name is Shalini.
Hi. Go ahead.
She used to have the PCA, that is 110 hours.
Mm-hmm.
And so in the daytime also somebody was looking up, is taking care of her. And night shifts also, she has a lot of problems. I handled her and managed her till she was 33, 34. I never asked for any services. My husband's health deteriorated, so I asked for the PCA service and I started getting. Now, as I understood, or my support coordinator tried to make me understand, is that 8 hours would become for the whole day something.
Mm-hmm. The day rate versus...
Day rate.
Yeah. Mm-hmm.
And then after that, the night shift person comes. How would that person be rated?
I'm sorry, how would that person work?
8 hours in the day, 8 hours is over.
Uh-huh.
Then the night shift person comes, that is another 8 hours. So how do we bill? Is it the billing? She said, APD tried to explain how that you bill that as for a quarter hour.
Yeah. I don't know if Clarence could help me out here.
I hate to do this, but can you repeat the question? Because I'm not hearing it, what your question is.
Day rate that becomes, as for the whole, more than 8 hours or whatever it is, $112 and something.
Right.
So after that, if the night shift person comes, is she, yeah.
Okay, I see. So, you know, we do our billing
You really
by
want to take the
the,
microphone, please, Clarence?
And I also have one more question. The light
Go Gators.
Is that your team, Mike? Is that your team?
No, I don't,
So,
I don't pick favorites. Actually, I'm a Nittany Lion.
to address her question, basically she's asking about, we bill, the providers bill on a quarterly rate, quarterly hour rate. And there is also a daily rate, which is set for PCA at $112 and some change. Now, it becomes an issue, say that if the individual is covered for 8 hours a day, and then it's extended to 10 hours a day, the 8 hours is billed at quarterly, but if you're doing 10 hours or more, it's going to be at the daily rate. Well, there's no way anyone could be covered at the daily rate, and it's not expected for them to be covered 24 hours a day at that daily rate of $112 and some change. So, what she's really getting to is, how do we expect to cover day, night, everything else at $112?
Yeah, because it will be like, it will not be even a minimum wage. Nobody
here.
is ready to work.
Right. And so what happens is, the agency is not expecting for 24-hour coverage.
It's not 24 hours.
15, 16 hours. What we really have to think about here is there any other source, natural family members, natural supports, or some other community resource that could help offset those hours?
My daughter lived in Marin County. She was working with this year. She used to help me till she was here. She's married and she's left. So now we do not have. We are already 64 now.
Right.
And she had an open heart surgery, which she can't cover. I had accident, my left side is on my neck and back. She's on to go. I can't even turn.
Sure, sure.
She calls for this
Okay.
way, I can even tell.
So why don't we do this? Why don't you and I talk, and I'm sure we can figure out a way to help you.
Any questions up here? There? That's fine, I'll wait.
No, did you just hear her say thank you?
You're
Thank
welcome.
you. Thank you for joining us today.
Maybe have one over here. I apologize for the trying to keep up.
Hi, I'm Becky Layton. I have a 24-year-old with spina bifida, and we moved here within the last year, and I was not aware of the situation in Florida. We're from Western New York, and I uprooted my 24-year-old son, who had services, had a job, everything in place, and I feel bad, but I've been trying to find services here, and he is on the waiting program, and now that I'm hearing there's somebody 18 years on the waiting list, that's absolutely crazy. I have talked to many, many, many different agencies trying to find just home care for my son in the morning. Home care agencies won't take Medicare for long-term care. Medicaid won't bill Medicaid, so I have to self-pay. If I have to self-pay those agencies, I might as well not work myself. So it's a dilemma, you know? And I've been told by many of these agencies to put my son in a group home or institutionalize him. He is not a mentally disabled person. He can care for himself to a certain degree. And it just floors me that they told me that, to get help for him to institutionalize him. And he's 24 years old.
Right.
So that's my dilemma.
And unfortunately, many families make that decision. We try very hard to assist families that are able to care for their family member in their home. We try very hard to help them. And that's what most people on our waiver are in the family home. Something like 70% are in the family home. And that's our goal, to keep them with the family.
Well, the agency that I have right now, when I contacted the agency, they said, okay, he has Medicare, we'll accept him. I've had the service now for several months. And just within the last 3 months, they said that we're going to reevaluate him and we're going to drop him as of the end of June. So now I'm trying to find another agency that will take his Medicare and bill Medicaid separately, which none of them will, that I've found. And I don't know, I lost my train of thought, but...
Do you have a support coordinator?
No.
Okay. Well, that's essentially what a support coordinator does, is try to help you navigate this very complex system. And I realize how complex
I know what I was
it
going
is.
to say, I'm sorry. This agency is sending aides to my house 3 days a week. They're paying her $10 for each visit for 2 hours to get in my house. And we live kind of out of the country a little bit, so she has to, it was costing her to come to my house and take care of my son for that 2 hours. So she quit. So it's just kind of crazy, but anyway.
Mike, if she's on the waiting list, she should have a state support coordinator.
She should. So I'm going to ask Clarence, she's on the waiting list for the, so if you had one of your staff get with her and try to assist her identify resources, that'd be great.
I have talked to Francis Moses.
Okay.
I talked to Francis.
I have two related questions.
Yes, ma'am.
I know this past year we had concerns about adult day programs
Yes.
not being funded, and then I think through your intercession, they were funded at least for this year.
Yes.
Can we expect that same kind of problem next year?
Ma'am, thank you for the question. I don't know what the future holds in terms of the state budget. Things are looking better. The economy is turning around. Revenue collections for the state are up. There are a couple of issues that could have an impact on state funding. All these things work together. I don't know if you're familiar with the lawsuit regarding pension funding, but there's a big lawsuit regarding that. Depending on what happens with that, that could have an impact on funds that are available. All these monies come out of the same pot. I mean, the money that we get comes out of the same pot in most cases. I mean, there are trust funds, but most of it's all fungible. I mean, you can move one for another. So, given nothing happening to the state budget that's not anticipated at this time, I would think we're not going to have that issue. It was pretty clear that the sentiment of the policymakers in Tallahassee, who are from all around the state, believe that that's the appropriate thing to do, is to continue to fund that service. So I don't expect that's going to happen.
Well, my next question is related to it. I'm a teacher, by the way, so yes, I'm very familiar.
So you're very familiar with that. Yes, ma'am.
And I was wondering, maybe since adult day programs seem to be the most requested thing, I mean, most people on the wait list, especially if their kids are coming out of school, just want something for their child to do during the day. And maybe adult day funding or adult day training or programs, whatever, should not be perhaps an individually funded service, but maybe it should be more like you give funding to the school, to the district or the community for for the ARCs or the schools or somebody to, you know, programs that are already there to provide, you know, they get X amount of funding for each person who needs it in the district. And then they just provide the funding, and whether you're on the wait list or whether you're on a waiver, you do get the adult day programs because they're funding larger agencies to provide them.
Well, thank you, man. I appreciate that comment. We actually do that in some cases where we do fund providers to take care of primarily people on the wait list for services like adult day training. The problem is, you know, it's convenient for me, but I'll blame the federal government. You can't, a waiver service has to be provided to a, you know, for a Medicaid eligible person to a Medicaid eligible provider. So I couldn't go with waiver funds and go to someone and say, you know, here's some money, take care of whoever comes through the door. Now we do that with our IFS program, Individual and Family Supports Program. We do have some contracts to do that. So we do that in some cases. But that IFS money...
They're already eligible for APD services just on the wait list, you know?
Right, and we do that. We absolutely do that in some areas of the state. We have a contract in Miami where we do that. But the problem is the IFS, that IFS money, Individual and Family Support money, there's only about $13 million in that pot. You know, the waiver's got $810 million in it. So, and the IFS money actually shrank a little bit going forward. But great ideas. We are working on ADT. We have a lot of activity going on in that area, and we hope to have some improvements in the near future. Let me just put it that way. But I realize how important a service that is.
My name is Bob Phillips. I'm from Marion County. I'm relatively new to the APD and the processes and selection, this sort of thing. But my question is this. We're on the wait list. What rules govern whether someone's on the waiver or on the wait list? What choices do I have? How could I make a difference? Or is it dice roll and I just got to hope for the best?
Thank you, and I appreciate for someone coming into this system the complexity of how complex it looks looking in, and you know, what government program isn't like that? They're all very, very hard to understand and confusing. So hopefully we're going to make that, we're going to do as best we can to change that. But whether or not, this all comes down to money. It's all a matter of the resources available. The legislature several years ago imposed a freeze on a new enrollment to the program. So no one's coming into the program now unless there's a crisis. And so you probably applied recently, is that correct?
2007.
Since 2007, there's been a freeze on admission to the program. So you go on a wait list. So everyone who's applied since then goes on that wait list. Now, some people come off the wait list. Okay, and the way they come off the wait list, as the gentleman back here described, is if they have a crisis. If there's such a situation where you say, I can no longer keep this person in my home, you know, whether it's your child or whatever the relationship is, I can no longer keep this person in my home because, in many cases, people on the wait list, they've been on the wait list a long time, and the parents are getting old. And again, we see these cases every day. They've had a stroke, they have cancer, they've broken, you know, a hip or something like that, and they can no longer provide care to their son or daughter. Those people do come off the wait list and they go on the waiver because we have no choice. And that's the only way you get in now is through that crisis. Or if a lot of times children, as they go through adolescence, their behaviors tend to increase, and a lot of times they're growing, they're larger, their parents are older and frailer, the parents can no longer deal with the behavioral issues on a child who may weigh twice as much as they do and who is, you know, violent towards them. They have no choice. Something has to be done. Those people come off the wait list and go on the waiver. So that's the whole problem with this. We are dealing with, the blazing fires is what we're trying to put out, is exactly what we're doing. And I wish that weren't the case. I wish it didn't have to be the case. But I don't know right now how to fix that other than to convince the policymakers that we're using our money appropriately, that we're spending it wisely and fairly, and that there are a lot of people out there and on the waiting list. And I think once they're convinced that we're doing that, that's what the iBudget is about, we're using this money appropriately and fairly, that then they'll give us additional money and we can begin bringing people off the wait list. That's our whole goal. I hope that is a little clarification, but I realize it's very, very hard to understand.
We have about four for you, so do see your hands, and we're with this gentleman right now.
Okay.
Director Hanson, my name's Mark Swain,
Hey,
and
Mark.
I want to congratulate you for having the courage to try to do something about this system, because I know for a fact you're in a situation, no matter what you do, you're going to be criticized for something. I think that there's a lot of money that can be saved in system efficiencies. And what I have to say is this, when I was in your office earlier this year, we were talking about transition and all those type of things and measuring providers. All those things are very important. And I think that your mind works very well that way. The one thing I think that's like being expressed here by this family is that there's so many variables within the system to be focused on. I would suggest that we focus on things other than rates exclusively. Okay? Rates can only be compressed so far. When push comes to shove, what we're talking about are services, and those services are purchased. And once in a while, you can have a church or something pick up and do some things like that, but as a system, that's not going to work. People need to purchase a service. And I think sometimes we talk a little bit too much in terms of annual rates. I think we should talk sometimes in hourly rates. Keep looking at transitional systems. Keep looking at ways to improve efficiencies within the system. We keep pushing down the rate and rate. We're going to have more of these results here. Rates can only be compressed so much. Right now, if you have a moderate ResHap plan of $3,200 a month, full ADT, and full transportation, that translates to about $5.77 an hour. Can't be compressed too much more than that. On the other hand, we have institutions, all sorts of non-transitional institutions that can be looked at, all sorts of different ways that can be used to increase efficiency. And I think that you should be scoring providers on transitional performance. And I would just urge you to continue that interest and to continue looking at those things so we don't have families in this situation that just can't make ends meet. Because they have a situation where they have an hourly rate problem. And the annualized rates, it's hard to understand that. When you're talking about big numbers, it's hard to understand that. Hourly rates are easier for people to understand. But keep focusing on other system efficiencies, please, because you're good at that.
Thank you, Mark. I appreciate those comments, and I agree with you completely that we've compressed rates about as far as we can compress them, and I agree with you completely on that, and we're trying to focus on other areas, and performance is really a key. I mean, if you're paying for some, I mean, what I want to pay for is performance, and I'm happy to pay for performance. I don't want to pay for mediocre performance. No one wants mediocre. Everyone wants good, and that's what we're trying to figure out. How do we get there? So I have not focused on rate reduction. I think you've noticed that. I have not focused on that. Yes, sir.
Yeah, good afternoon. My question is, I just want to ask, my question is about the question that lady asked about her daughter. Ben, this is a public forum. I heard the gentleman told her that I will talk to you about that later. It's many other folks that have the same situation. And I think that question is something should address publicly. So the other folks that have that similar situation, I know they do let their support coordinator know about it. So I think her question should address publicly. Thank you.
Thank you, sir. I appreciate that. I'm not exactly sure how to do that. I'm not exactly sure. again, I think in many of these cases, you need to deal with, I try to deal with everyone on an individual basis. I certainly don't want to discuss in public an individual, family situation. If we had and we'd be happy to get with her later and do that, and we've committed to do that. If there's a sort of a policy question or bigger question that you'd like to phrase for us, we'd be happy to try to address that. And I can't tell you, I can't answer everyone's questions. I'm willing to listen, and I'm willing to to take back with me your concerns, and I'm willing to work on those concerns. But there's no magic answer to a lot of these questions. These are very difficult situations. We try to make a little progress. I mean, my goal is I want to make a little progress every day. I want to make things a little better every day. But I'm not going to get myself frustrated and say I give up because it's too hard or it's too complicated. I know that families, many of the families here are facing a much more difficult situation than I'm facing, with their lives every day. And I appreciate that, and we're trying to improve. That's all I can say. I'm trying to make things better. That's what I'm here for. That's what I'm trying to do. So I need to understand exactly what the nature of the problem is, and we need to get that, and then we need to figure out, okay, what are our options to move forward. That's what I want to try to do. So, but thank you for the question. Yes, ma'am.
Hi, my name is Darla Perry. I'm from Citrus County. I have a 21-and-a-half-year-old son who's autistic and medically fragile. Ooh, sorry. Did you hear what I said so far?
Yes, ma'am. I heard you.
Okay. First off, I wanted to thank you and APD because my son, with your assistance, has been able to be independently in his own apartment for a year, which they told me to institutionalize him and not do something. And I'm just proud of him that he's done this. My question is too, at what point in Hillsborough County is the iBudget going to be there? And my second question is, we're on the CDC Plus program. How does the iBudget affect that program? Since we're already giving 12% back to you guys to lossage in our budget just to be on CDC Plus, what does iBudget do for us?
Thank you for those questions. And you're the example that I like to give in terms of why families need to be involved and why there's no substitute for the mother or the father or whatever relative being involved and saying, okay, this is what's right for our family member. So thank you for doing that, and thank you for making sure we got that right result. That's always what we want to see happen. I know the sort of boilerplate solution is let's stick them in an institution, let's stick them in a group home, case solved. I never like that outcome unless it's the only way out. So thank you for your advocacy and what you did. In terms of, you had two questions, Hillsborough, when are we coming to Hillsborough? Art is going to help me with that. Art, you're the man. When are we going to Hillsborough?
Hillsborough, that would be Clarence. That's your area, correct? No? I'm sorry.
That's Jerry.
Oh, Tampa. Okay, Tampa?
Oh, I'm sorry. Yeah.
I apologize for that. I wasn't sure of my counties. I've been on the road for weeks.
Yeah.
Tampa, we will be implementing October. January 1st. It's on. I'll be showing on the presentation a little bit later this afternoon. So we'll actually be training out there in about 6 weeks.
Okay. So the second part of your question, what about CDC? That's been a difficult thing to answer, how we're going to deal with CDC. So what we've decided to do is wait till the end. We're not going to implement, anyone who's in CDC, we're not going to implement iBudget on CDC until the rest of the state is implemented. And then we're going to figure out how we deal with it, because it is complicated. So it fits with my pattern of I'll fix the things I can fix first that are easiest, and I'll save the really hard things for later. And so that's what we're doing with that.
I'm next.
Yes, ma'am.
You were talking, I'm Eileen Reedy, and I'm on the Family Care Council. I'm from Hernando County, and I have a son who's 40 years of age and who is on the wait list. You mentioned about the cost plan in the first area that you did, which is Panhandle. Okay, were there any changes in the cost plan, the cost of the cost plan from before the iBudget to the iBudget? Did you have any savings?
Let me try to understand.
Okay, an individual cost plan, you
Yes,
said,
ma'am.
and then you came up with another cost plan for the iBudget for the individual.
Yes,
Did you have any savings from one to the other?
yes, absolutely.
Okay.
Yes,
so
we
then-
did, absolutely.
So then there is money. Okay. What would you say to somebody who's been on the wait list for 5 years? And I've had emergencies just recently. I had some cancer surgery. And, you know, the first thing the doctor said to me is, when can you come in and get it out? And my first thing was, I can't come in on Friday because my son doesn't have a program to go to. So, you know, there are many people like me who are single parents who need help. Who do you go to? A neighbor?
Okay, that's a great question, and you're on the wait list, you said, correct? And so you have someone that works with Clarence who is your support coordinator? I would suggest you talk with them. We do have what we call IFS money, individual and family supports money, which doesn't require you to be admitted to the waiver. They can give you a one-time services with that money. So if there's a situation where you believe, you know, you need respite for a day or something like that, to deal with a medical condition, they have resources they can assist you with to do that.
Okay, and then I called ARC and I said, could you bus him and bill me? And that's what they did. Okay, so I mean, there's ways around it, but you know, as a single parent, I look to myself and I say to myself, God, this is a horrible situation for anybody on the wait list to go through, and then to have to say, oh no, I can't come in on that day because my son doesn't have a service that day that he pays for. So I mean, there are needs here, and the wait list has to end. I mean, I can't tell you, I have been to Robert Schenk's office a number of times with a number of parents, and we've all pleaded with him to help us. And I mean, some people have waited 8 years. Some people have people in wheelchairs that are sitting here and need help. I mean, you know, we all have to share in the services that we have. And, you know, we all pay taxes. So, you know, if you could help us in any way getting to the state legislature and try to end this as soon as possible, I think everybody here agrees that we need to get this done, and soon.
Right, and I agree with you too. I mean, our policy is to try to end the wait list. That's exactly what we're trying to do. And the only way that we know how to do it is to demonstrate that we are efficient with the money that we have, and that we do need additional resources to bring folks off the wait list. And that's what we're trying to do. We are very desperately trying to do that. But I understand your concern. I agree with you. You know, I'm not an appropriator. I do not make those decisions about how much money is allocated to each state agency. And so it's not within my power. What is within my power is to make sure I wring every, you know, efficiency I can out of our system, so that the money that I do have, that I could begin, if I could, to pick people up off the wait list. That's the power that I have, and that's why we're trying to do this. But as a family care council and, you know, as advocates, you know, you're doing the right thing. Talk to your legislators and convince them of the need to increase funding. Yes, ma'am.
Hi, my name's Lynn Sear. I have a daughter with Down syndrome. She was born 13 years ago. I put her on the signed up for the wait list when she turned 5. I've tried to play by the rules of what I know the rules to be. Right now, I'm looking at her future. She's in middle school. We're not in any kind of crisis. Thank you, God. But my concern is the future, and I don't know how to position her and my family. I mean, she's my daughter. I'm always going to take care of her as a parent. But what I'm seeing is the day she turns 22, goodbye, any kind of education. I'm looking at self-determination, and I'm thinking those are really wonderful things, and my daughter's a candidate. She's not in a crisis like others, and you don't throw tomatoes at me. I feel for you. we're not in that position, but what do I look at the next 8 years? We've been on the wait list for 8 years. I've got another 7 to 8 years before she turns 22. The reality, to be very honest with you this winter, was I lost my job. I'm considering divorce because she would continue to get Medicaid. Not because I have a marriage problem, but because she needs the Medicaid. My husband's self-employed. We don't have insurance. The job I had, the co-pays are $35 every time you go to a specialist. When you're only making 10 bucks an hour, and then you get a letter from SSI out of the blue going, sorry, you're making too much money. And you're kind of going, really? Really? And you go back to SSI, and I mean, it becomes a full-time job. I don't know how, I mean, I hear about case coordinators, which that's wonderful. I'd love to have one. I'm not in a crisis that I need one. I don't even know where to go forward from here. I mean, I come to a meeting like this to try to get information so I can advocate for her. But in listening, I'm thinking, okay, I'm not in a crisis situation. What would even be my next step? And I know you don't have a crystal ball, and I can appreciate that. What are the rules going forward?
Difficult situation, difficult.
Damned if you do, damned if you don't.
Well,
there is somebody over here who might have an answer.
No. No, I got a question.
Okay. Well, yes, sir.
May I try to help her?
Yeah.
So, one of the things you have to really consider, what future do you want for her? That's sort of a starting point.
Right.
And then, from there, we can look at what resources are available within the community or within the agency. But you and your family need to decide what kind of future you want to help her with going forward.
And I do have that answer. I mean, I can see her being a contributing member of society, and I can see her having employment with the supports. You know, something where she could be living on her own, probably with some supervision, not necessarily a group home, but something independent, something that, you know, where the safety net is sort of wide, let's put it that way. When the day she turns 22, is that when I call you folks and say, okay, we're here?
No, not when she turns 22. You want to begin before then.
Okay.
Because one of the key things I heard you just say is supportive employment.
Right.
You need to come to us. We can help direct you, because vocational rehab is part of this as well. And so once you go beyond the educational system, we can look at, and Stephanie's involved with this, supportive employment, vocational rehab. So there are some avenues.
None of which.
None of which depend on how much we make in our household?
Right. No.
Okay. Okay. Now, and the other thing, before I forget, I'm hearing rumbles about IQ. If her IQ is too high, then she doesn't qualify? I mean, yeah, she was born with Down syndrome.
No, then she qualifies.
Okay, so that blood work will be enough?
Yes.
Okay.
All right.
All right, we're going to go back here and over here.
Hi, I'm Anna, and I have a daughter who's developmentally has a disability, and she's 16 years old. I'm very involved with the Family Care Council and with the school side of things. And I heard earlier that we talked about Part C, which is the Individuals with Disability Education Act, Part C, for 0 to 3. Then I heard Part B of the Individuals with Disabilities Education Act, which would be Part B. And it seems like the whole mission behind IDEA is that further education, employment, and independent living. Well, where does 26, the age 22 or the 26 come in? Why couldn't there be like a Part D that funded our kids, that's federally funded? So like when they're leaving school, there's this great plan, because let's face it, voc rehab doesn't take everybody. You know, if you don't qualify for voc rehab, then you have to go to ARC or an ADT, and then APD can't fund it because they're over budgeted. My daughter deserves a meaningful day. She's worked hard in her individualized education plan to build those skills, to be an active community person. And I'm going to tell them, sorry, the state of Florida can't help you. Mommy doesn't make enough, so you're going to sit at home all day. But if the whole mission was started at further education, employment, and independent living, why does it have to end when the age ends? It's just not fair. I think you guys need to help us advocate that to the federal government, because if the federal government kicks in, it'll help our kids turn into adults. So can you help us?
I think I don't have a magic wand in my back pocket. But, you know, the situation you're facing is sort of coming of age in America. I don't know if any of you saw the article in Time last week. It was all about this. They had a whole series of stories about families with children that are now leaving the school system. What happens now? And there just is nothing. This isn't a problem in Florida. This is a problem in this country. It absolutely is. What do we do next? Gee, you know, I'm trying to deal with my program with the current things that I was like. I appreciate the discussion. Obviously, I am not in a position to change federal policy or state policy. I have to implement the laws, you know, as they currently are crafted. You know, I appreciate the situation you're describing, and we just have to keep working and trying to figure out what do we do next. So, you know, they're very good points. Very, very good points. We got to do something. Yes, sir.
Hi, how you doing? My name is John Langen. I'm a new resident here in the state of Florida. I lived in Pennsylvania for a number of years and was very successful in getting family funded waiver for my son at the age 21 when he had to transition out of school. So I was very active, involved in that, and was successful. Came here to Florida for my in-laws primarily because they're, you know, aging and you know, they need help here. So I had to give all that up and come here to Florida with my 24-year-old son. And now, you know, we basically have no services at all. He is on the wait list. I hear you speaking a lot about the current budget that you're in and your $800 million bind, but I'm not hearing anything about where the projections are for what's truly needed. I understand what you have and the current people that are on, you know, getting services. You've got an $810 million budget. You've got, I forget what the number was in terms of people on the wait list like my son, but what's the statistics on that? What's the assessment in terms of the anticipated budget for accommodating those services? And then knowing what that total budget is, how do we target to get to that? So if you need $1 billion to support the people that are currently on services and currently need services, that should be the target goal. Not working within $810 million and trying to squeeze every drop of blood you can out of that and then keep you at that cap. I mean, why are we looking at the total budget for everybody that's in the state of Florida is $2.5 billion. Okay, now let's look at, from that $2.5 billion, how do we find ways to fund that from whatever we have to make that happen, to help provide the appropriate services. And then, of course, obviously try to get the right balance in terms of everybody's individual's needs. I mean, my son sits home now all day long. I work full-time from home, thank God I'm able to do that. And so my wife is busy trying to keep him occupied day in and day out, and I'm just stuck in my little office, you know, trying to stay at work for 15 hours a day. And then I have my in-laws next door to me who need my assistance on a daily basis. You know, my father-in-law's 80, he just broke his hip, he's in now a rehab now, and, you know, I'm spending my nights trying to support and take care of him. So, but I don't think anybody knows what my son's needs are, even though he's on a waiver list. But how do I get those things updated so that it's constantly monitored and that there's an awareness to know that, you know what, in 20 years or 5 years, whatever it might be, I die tomorrow, right? But we know that this young man needs this type of service, and it's going to be this much impact on my budget so that it can be accommodated. Because I'm hearing, I understand your point. You're working within what you have, but what do you need? I haven't heard, I need this, and this is how we need to try to find a way to fund it. So any ideas on how to be able to get those statistics and get those numbers and set that baseline to know for the future how to address truly the future as opposed to just crisis over crisis over crisis. I got to give up my son and put him in a crisis situation in order for him to have services. It doesn't seem right. And if we are doing planning around individuals, I don't understand how this woman is in the situation she's in. If she's been budgeted and planned for services for day and night services. How does she end up not having the services she needs? I mean, it just boggles my mind. If we really are planning for individual needs, then her needs were missed. So how did that happen? I don't get it. And, you know, obviously, I made the choice to come to Florida to take care of my in-laws and to take care of my son, and that's okay. And I'm like you, I get it. You know, I own the responsibility to take care of my son and make sure his needs are met, and I'm willing to do everything I can to plan for that. I don't want to dump them on anybody, but I also want to know that I have a very small family. It's just me, my wife, and my in-laws. That's it. There's nobody to go to help out. So obviously, in the end, at the end of the day, he's got to end up somewhere. And unfortunately, he is an ICF individual. Right? I mean, I just petitioned the courts of Florida now for full guardianship, which I got. I had it in Pennsylvania. I transferred over. What a nightmare that was to get it done here in the state of Florida. But at least I have full guardianship because he just can't make those choices for himself. And he doesn't understand. If he was in a house and there's a fire, he wouldn't get out. And he's physically capable of moving. He just wouldn't understand the dangers to do it. So I know that he definitely needs those types of services. And I'm trying to do like everybody else, just plan for that future. But I'm not hearing what your total assessment is. I mean, what do you need? What do we need to really know what the baseline is? And then figure out how to cover that somewhere, somehow, if possible. So, I'm not even a question, I guess, just more of a
Yes, I
statement.
appreciate your comment and your suggestion. Thank you, sir. I appreciate that. Do I have an answer? To how much total money would the agency need to serve everybody on the wait list? I do not have an answer to that. We have not calculated that.
Is it being addressed at all?
I'm sorry?
Is it being addressed?
Are we calculating it? We have not calculated it. We have not. Sir?
That would be a good place to start, trying to know what we're really doing.
Can we put it on the radar when there's extra coming in?
I guess my question is kind of related. Are we looking at?
There we go.
Are we looking at the number of students that are exiting the school system at age 22 and comparing that to the names that are on the wait list, just to do some future planning? I work for the educational system along with Stephanie, and it's, if we looked at the numbers, because they're receiving services in school till age 22. Maybe not enough services in terms of the situations that they're in, but once they exit the school system, that's why I'm an advocate too for the adult day training centers, because at least it is an avenue for them to be somewhere and get some kind of services during the day. So if we looked at the list of students every year that are exiting, that are age 22, who are on the wait list, and compared it to, I don't know, it's just a suggestion I have, because I think the adult day training services that are in place, the centers, at least it gives the parents some time, some crisis, some respite time, because the students are busy.
Right. Well, in fact, the law requires us to categorize people on the wait list by those exact categories. How many are certain ages, how many are aging out of certain programs. So we do have that information. I mean, that's how we store the waiting list, and it's got a priority. And when we get money, that's where we would start at category one. And category one are people who have aging parents that above a certain age who are frail and are going to need services for their children soon. So we do have those categories, and we know how many we have in each of those categories. Again, the resources that we have now don't allow us to begin to pick up those lists, but we are keeping track of that.
Maybe just take a couple more
Yes,
questions
ma'am.
in that, so that, because people are hungry.
They're ready for
They're
lunch.
migrating over
Okay.
there, so.
Yes, ma'am. And I'd be happy to, when we're done, to sit and chat with anybody on a one-on-one basis, if that's okay. Thank you. People are ready for lunch.
Hi, my name is Kashin. I
Yes, ma'am.
have two disabled children. My son has a hearing impairment and my daughter has autism. That was better?
Yeah.
Okay. My 17-year-old has a hearing impairment and my 15-year-old has autism. My health is failing. I'm not very old. I'm old, but I'm not that old. I'm in poor health where I've never even heard of IFs before. When I go in the hospital, my children are there. I have to have my neighbors to keep an eye on my children. I've never heard of that information before. I've never even knew the program existed. So if that is available, I'd like to know how to get it. I don't want to be in the hospital been waiting for my blood pressure to go down, and it won't go under 160, you know, with that being over 108 or 109, because I'm worried about my children at home.
Clarence?
So what county are you in?
I'm on the waiting list. I'm in Marion County.
Marion.
Marion County. You want to find a lady here by the name of Tracy? Okay, get with Tracy. Does she know your situation, Karen?
I'm 61 years old. I have a son who's Wednesday is the last day of school, and he has to go in the program, and I cannot afford to pay. So I have a surgery in my early knee, and so I'm going to put him in the program. He's going to stay home, and I can't, you know, I have to find a program for him.
Right.
Okay, which I know. I was going to sign him up in building blocks in Claremont. But then they told me I have to pay because Medicare doesn't cover it. He has Medicare, and it doesn't cover.
Right.
So
he's on the wait list?
He's on the waiting list, yeah. And then, you know, like I said, I'm just one. And Wednesday's his last day, and I don't want him to stay home.
He's out of school for the summer, or just
No,
he's done?
he's 22.
He's done, yeah.
He's 22.
Oh, he's 22.
Yeah.
Clarence?
What county?
Lake.
Lake County, okay. Information, Debbie?
Yeah.
Congratulations. That's not going to stop it. So, and Debbie's here, so why don't we get with her? We'll just figure it out.
I'm curious about the fact that the state, and I know it sounds judgmental, and it probably is, seems very content with keeping people on unemployment, and it's hard to find ways to get them on unemployment or off unemployment. Is there a way that, because this might be a resource that could help all of the parents, help the APD to, you know, if they're on unemployment and they have skills that would be, like if they're teachers or if they're therapists or if they're nurses, whatever, could they be on unemployment and still subsidized for helping with these disabilities instead of taking all the money out of this pocket, putting it into this pocket and saying, well, we tried it, didn't work out, we didn't have enough money, and now you're back in that old pocket again where you can't survive. But, you know, it just seems to me, and we don't really seem to have a substantial volunteer system. If people want to volunteer, so often there's a situation where they're going to be penalized because, well, if you could have spent your time doing this or whatever, you know, but can we find other resources that may not cost us much money?
And point well taken, and we've developed a whole unit at APD to try to identify additional resources, and we're trying to take advantage of all those potential resources in the communities to make them available for APD services. And we are working on it. We have a whole team that's working on trying to do just that. Yes, ma'am.
I'm an old lady, and I've spent many years doing advocacy with legislators, trying to let them know that just because we live in Florida, a state without an income tax, doesn't mean we have to be 49th nationally on the amount spent for people with developmental disabilities. What would it do? Would it kill us to have a 1-cent sales tax for developmental disabilities? And how can you, because you're in Tallahassee with the legislators, how can you help us? We talk to the legislators, they don't want to hear taxes, our governor doesn't want to hear taxes, but that is what we need to solve this problem so that every year we don't hear more about budget cuts and have to do the same old thing. Is there any way to get around this? Can you help us? Talk to the governor, tell him 1 cent sales tax is not going to kill the businesses that come here. It would help us. Can you help?
Thank you, man, for that comment. I can tell you a lot of people that would like that 1 cent dedicated to them. So that would be quite a battle amongst all the interest groups that think they have sole rights to the 1 cent. And of course, the impact of any new, there's always an impact of a new tax on economic development and on business. So it is a, it's a situation. I have to tell you, my own personal philosophy is that, we should keep taxes low. It's just my personal philosophy. But that's not what I'm hired for, to set that policy. What I'm hired for is to implement and manage this program based with the resources that they've given me. And so that's what I'm trying to do the best I can. And I certainly respect everyone's opinion with regard to what they think the right solution is. I'm just not the right person to communicate that to. But I appreciate it, man.
Director, we had one more burning question.
Okay.
That's okay. I believe from back here.
Okay.
When you wrap up,
Director.
if you can give an email address or something for people to ask
this
questions.
question sooner before everyone got so hungry. I would like to know what the current status is on the residential fee collection. I do know that there's kind of a debate and from us stakeholders and our concern with it. And I guess with your answer, I'd also like to know what the plan is for accountability and how those funds, if they are going to be collected from us as our loved ones have to turn monies back over, what the accountability is on how it's going to be spent.
Thank you, man. Appreciate that question. And as you're correct, that issue is still under discussion. There's a proposed rule that the agency's proposed. This was one of the potential solutions that was brought to us from a stakeholder group of I think Betty Kay was on that group. We worked with the governor's office last summer to try to look at all options available for managing our budget. This was one that was brought to us. It was supported by provider community. They actually suggested it. It is not dissimilar from what's done in other state settings, state-supported settings, in nursing homes, in adult living facilities, in ICF DDs, pretty much any place that you go where the state is providing you support. If you have income, not earned income, but unearned income, you have to turn that over to cover the cost of your care. In a nursing home, you get to keep only $35 for a personal needs allowance. What, ma'am?
78-year-old people are not people that are get out and need the money and out of payment set.
Right.
Trying to settle on disabled people with the budget is wrong.
Right. Well, sir, I appreciate your comment. Again, we're looking at this now. Consider the situation of what's the fair and right thing to do, and that's what we're trying to do. We have set that amount at $93, not at $35, so it's much higher than in a nursing home. In an ALF, it's still $35. Those are not necessarily old people that are elderly. All kinds of people live in ALS. So it's not a dissimilar policy to other programs. I realize there's a lot of emotion attached to this and a lot of concern. I have concerns too, and I've heard from a lot of people, and I've really studied. I've studied this to see, is this the right thing to do, is the best thing to do. On the one hand, someone comes to us and says, we want you to pay for our care. We want the state to pick up the obligation of taking care of us. But on the other hand, I have income and I don't want to contribute to the cost of that care. Or I don't want to contribute, a certain amount to the cost of that care.
I buy my clothing, when I need a jacket, you're going to provide that, you're going to provide my clothing, or you're going to do like the legislature told me, you're a parent, you go buy it for me. I'm 74 years old, I'm not just going to pay for it that long. So who's trying to provide for my 40-year-old child? Where now I can help them with the budget, and when you need a new pair of pants, I can go buy it for them. You're going to take the money, and what you're going to do with it, put it in the slush fund. You're going to be accounting for what's split.
No, sir.
I have another question. I am responsible for his pay. So how do I report this on your Social Security? When I get a Social Security, how do I report this? Do I get the state of Florida back $80 a month? There's no place on the form that says.
Well, we're working with the Social Security Administration on the proper way to do this. Again, it's under the consideration stage. We have not finalized this yet. We're looking at all these questions, trying to figure out what the right thing to do is here. And yes, ma'am. Yes, ma'am.
Communication coming out of your office to us as I'm a guardian for my 50-year-old brother.
Yes.
And I have sent letters and phone calls, and I get a letter giving me a 2-week notice. I got a letter a week ago telling me, whoops, it's all changed, and now it's not going to be May, it's going to be June. That communication is very poor. We can't make plans. I can't anticipate. I can't even get answers as far as what are going to be the exclusions. Am I going to be able to do co-pays? I keep getting referred to the red book. Oh, look at the Social Security red book. There is no different answer, no guidance at all. If we're going to come down with something to free that goes across the board, we have to submit dollars back. We've got to know how much. What are we still going to be able to pay for my brother each month, which can change depending on his medical status. So it can't just be sent out 2 weeks ahead and say, hey, it's due about the 15th.
Can't hear any of this.
Nope. Put it away.
Yes, ma'am. Yes, sir. I appreciate the confusion of trying to deal with the federal and state bureaucracy, and I'm a citizen too. I feel your pain. Every time I deal with government, I have the same kind of reaction, and it's not nearly the kinds of levels that you have to deal with. So I'm very appreciative. That's why I say the good ideas aren't inside the truck, they're outside, the rest of the state of Florida. And I try to, I'll tell you what I try to do, is I try to use every common sense solution that I can, but I have to operate within a certain framework that exists in the world that I live in. And so, we try to do what we can do. Sir?
We're all doing the same thing.
Right. You don't like it. I can see that, sir. And I'm I appreciate your comments. We are in the process of reevaluating this, and I'm going to consider very carefully what you indicated, sir. Thank you, ma'am. Yes, ma'am.